Okay, this meeting is now called to order. This is the Public Safety Committee meeting for May 11th, 2026. I'm the Chair, Councilwoman Yolanda McCoy, 6th District. At this time, I will call the roll for those members on the committee first. Councilman Spadola? Councilwoman Bracy?
Present.
Councilwoman Darby?
Present.
Councilman Johnson?
Here.
Councilwoman Oliver? And President Congo.
Here.
All right, as a friendly reminder, only members of the committee should be making any motions and seconding. But there's a public note. Any members of the public who wish to speak on matters pertaining to only items on tonight's agenda will need to register by 5:30 p.m. For those in person, please sign in at the clipboard right near the door. And for those who are joining us virtually, please raise your hand or use the Google Form sign-up link in the Zoom chat. Each speaker will have 3 minutes, and please be mindful and try to refrain from any use of profanity or vulgar remarks at this meeting is being live streamed to the public. Okay? All right. So on tonight's agenda, we actually have 2 things we'll be discussing. First, we will have a presentation from the End Community Violence Now, Delaware, by Ms. Laura Footman, who is the executive director. Ms. Footman, you may take a stand at the podium or have a seat if you like.
Awesome.
And whoever else you would like to invite up.
Awesome. Tonight I do that and okay. You wanna come up? Okay, cool. And they'll be able to follow the presentation.
Yes.
Thank you. Good evening, Dr. Lauren Janelle Footman presenting for In Community Violence Now. I have the pleasure of serving as the executive director of the state's public-private partnership that was created in support of Longwood Foundation, Welfare Foundation, Jesse Ball DuPont, Christiana Care in the state of Delaware. And so tonight I am very honored to have the opportunity to present to you all about the work that we have been doing across the state, but more importantly, the opportunities that we believe exist moving forward. And we can go to the next slide. So here is a brief overview of our welcome and introductions, what we just did. CVI 101, a programmatic overview and question and answers. Council members, if at any point you have any questions, please feel free to stop me because we want this to be as informative as possible for you all. And we can go to the next slide. Welcome and introductions, next slide, please. And I am joined today by our program officer, Danielle Fisher, who actually facilitates our Wilmington CVI coalition, which I'll share a little bit more about. But we are certainly a mighty team, and so look forward to share more about the work that we do together. Next slide. Next slide. And so when we talk about community violence, we want to be very clear on the definition that we are referring to. And so I will not read it, but I think it is important that we identify we are talking about violence that includes a firearm, because we, of course, know that there's structural violence and other forms of interpersonal violence that communities disproportionately impacted by violence do experience. Next slide, please. And again, we are actually exploring some opportunities to better align our domestic violence and community violence ecosystems. But again, it is important for us to have the distinction between community and partner and family intimate violence. Next slide, please. And so when we think about community violence intervention, it's very important that we're clear on the types of violence we're talking about. We're talking about breaking the cycles of retaliatory violence and group violence. And so when we are thinking about this, we are not thinking about suicide, school, or mass shootings in the way that we historically have thought about them. And it's very important. Okay. It's very important that we are clear, particularly in a space like Delaware, where we have had a lot of progress as it relates to gun violence prevention holistically. But when we think about CVI or community violence, group violence and retaliatory violence is still an emerging field nationally, and also something that Wilmington has absolutely focused on. But there is definitely a lot of education, I think, at the state level when we talk about funding this important work. Next slide, please. Who's most likely to experience community violence? Next slide. And again, when we think about who's most likely to experience, it is communities of color, particularly Black males 18 to 34. And when we think about the impact of community violence, we're thinking about injury, re-injury, or unfortunately death. And we think about the realities not only there for their immediate families, but the communities as a whole. And we recognize that this is a personal issue, a public health issue, and also an economic development issue. Next slide, please. And so when we look at the combined cost of homicide for the state of Delaware, we think about this is what it costs us to not be preventative and not to be proactive. And so it's not that we are currently not funding gun violence. It's just that we're funding it after a license loss, after there's lost wages, after there's law enforcement and other medical fees. And so, again, we know this is a public health issue. We also know that it is an economic issue. And this shows us just how much Delaware is just spending on homicides alone. Next slide, please. And so this is from 2023, and this shows us where we rank as it relates to the country. And so we are 12.02 deaths per 100,000 people. So when we think about Delaware and its size, the per capita data shows us that this is not only something that we can continue to fund episodically, that we need intentional investment in evidence-based strategies, particularly because, again, the life loss and the financial impact. Next slide, please. How do we address community violence? Next slide, please. So again, we stop the immediate bleed, and that is where we think about how we are identifying those that are at highest risk and being very clear that we need to not only have anti-retaliatory messaging, but we also need to provide them the stabilization supports necessary for them to be successful. And so when we think about a full ecosystem of gun violence prevention, whether it's hospital-based intervention, whether it is also thinking about community violence intervention, whether it's wraparound services or safe passage, it is most important that we think about that immediate bleed and how we build programs around that. Next slide, please.
I'm sorry, if I can just interrupt. I'm so sorry, Councilman Owens, for not acknowledging you, and Councilwoman Harley also. And it seems that President Congo has a question before you continue. President
Absolutely.
Congo.
Madam Chair.
Yes, you had a question?
Yes, thank you, Madam Chair. A couple slides back, you had the yes, a couple slides back.
Oh, President Congo, you actually are breaking up a little bit.
It was talking about the cost of violence, specific, or was that Delaware overall?
What was the question? I'm sorry, was that for Wilmington or?
Would you mind repeating that question, President Congo? You broke up a little bit.
Yes, when you broke.
I'm sorry, I no longer can hear you.
I think it was a slide on the cost of violence.
I think I'm going to try. So okay. So yes, that is for the state of Delaware, and so that was just the cost on homicides. It's actually 1.3 billion when we look at annual costs for all forms of gun violence.
So for the full state of Delaware,
Yes.
and that was like 600 something million.
Yes.
I'm guessing because I remember looking at that number.
You have a good memory because you're spot on. And so when we think about the types of intervention programs that are needed, and the good thing, they exist. Delaware is recovery and re-injury reduction. We do have a hospital-based program at Christiana Care called the Evolve program. And then also you have community street outreach programs all across the state of Delaware. And then of course you have law enforcement programs such as group violence intervention that focuses with high-risk populations, which is the top 1%. Next slide, please. And so what we recognize is that having programs is simply not enough, but we also must ensure that programs are evidence-based and funded for fidelity and improvement and are ensuring a standard of care and ongoing evaluation. And that is why ECVN was created. Next slide, please. And so we recognize that it is important that there is a collective impact approach to ensure that organizations are not only being funded, but they have the appropriate technical assistance. I don't know if you wanted me to stop. I didn't know if that was a question in the chat.
There is a question. Are you able to see it?
Okay, let's see. No, I asked him to type this question, but I don't see it.
Okay.
Okay. And so that means that we're funding for impact, having a backbone support, continuous communication, and shared measurement systems. And so there was a lot of conversation post the CDC's report that Wilmington actually commissioned in 2014, thinking about how the state could really, particularly at the time, Wilmington could really address this issue in the long term. And so with coordination from community-based organizations and again, the public-private partners that were at the table, they said a collective impact approach with mutually reinforcing activities were necessary. So some of the individuals that were at that table included Center for Structural Equity under the advisement of Daryl Wolfie Chambers, also David Chin from the Evolve program, and John Cook from Group Violence Intervention. Next slide, please. And so we recognize that it needed to be a multi-pronged approach, and so we're doing intervention, targeted enforcement, prevention, healing, and macro-level change. Data tells us that when we do all of these things to scale and it's coordinated, that we do see reductions in gun violence. Next slide, please. And so these are our values, but our ultimate goal is to make sure that we break the cycles of violence and foster safe and healthy communities across the state of Delaware. Next slide, please.
I do have his question.
Okay, absolutely.
It says,
I'm gonna need you to
sorry.
speak in the microphone.
Okay. So the question is, do you have a breakdown of how much it costs in Wilmington per year on violence? How much was the state cost again? And how does that compare to other states of our size?
So, number one, the cost of violence in Wilmington is currently not something that is studied. I think that that's something that we could absolutely work with. We talked to Nick Jr., which is the National Institute for Criminal Justice Reform, about their ability to do it localized to Wilmington. But that is something that is currently not available, but they're willing to do. And then what was his other question?
How much is it in the state of Delaware again? And then comparatively, how does that compare to other states?
1.3 billion. It is pretty standard based on size. I think the difference that we have, and we'll get a little bit into this, is that there is a level of investment regionally at the state level that we just currently don't have for a full funded ecosystem. So the cost is prorated or very similar different based on size. But I think the difference, which we'll get into, is just that it's not being, a full ecosystem is just currently not being funded.
And he says, Madam Chair, can I follow up?
Yes.
Okay. What does the 1 billion include?
So yes, absolutely. So it is loss of wages. It is also hospital costs. It's additional law enforcement costs. There is also the court fees that go along with it, and that's for every individual that is impacted by gun violence.
Thank you.
Absolutely. And so when we think about our theory of change, we recognize that it's important that we also focus on research and evaluation, because again, we can align, we can coordinate and fundraise and grant making, continually to advocate for policies and funding to do this work, but we also know that it's important, particularly in this climate, that we are supporting programs that have measurable impact, that is publicly available, particularly those that are using taxpayer dollars to really talk about the impact from an evidence-based perspective. Next slide, please. And so our goals this year are to deepen relationships, coordinate CVI ecosystems across all 3 counties. Tonight, of course, we're only focusing on Wilmington, but we are in Kent and Sussex counties, and we're also really focusing on strengthening workforce and partner capacity. So that is ongoing training. We've partnered with Cure Violence Global to bring Cure Violence back to the state of Delaware. We've also began working with the Wilmington University to provide trauma-informed certificates for trauma-informed organizations that are offered to organizations across all 3 counties, and then had our ecosystem trained in mental health first aid. And so again, as we think about advancing data and evaluation, we, through funds with philanthropic dollars, we're able to actually start to develop a evaluation framework that was based on input of community-based organizations in all 3 counties, but also brought in data best practices from the HAVI, which is the Hospital-Based Violence Intervention National Organization, Group Violence Intervention, and also Cure Violence, which focuses on community-based organizations. Next slide, please. And so program overview. You can go to the next slide. And so this provides what we do in Wilmington. Just to provide context, we coordinate biweekly CVI coalitions calls since June 2025. That was in response to a request by the CPSI team. And so since then, Danielle actually leads those biweekly. We've had presentations from some of the organizations there. You'll notice that we are comprehensive. So we've had the Wilmington Housing Authority, the Kids Department, Project New Start, community health workers. We have quarterly presentations with Chief Campos of the Wilmington Police Department to really ensure that there is accurate dissemination and people are using CompStat as a trusted source for data. We facilitated Johns Hopkins to come here with the Center for Gun Violence Solutions to discuss creating a violence reduction council to really think about how you have ongoing public health, law enforcement, and community members at the table to ensure that we are all having access to appropriate information. I've shared our ongoing TA. We've also engaged with Wilmington GVI leaders in transition to make sure that we are supporting their community-based intervention efforts, and also supported because we recognized when the government shutdown was happening, food insecurity was a huge issue. So we also gave a substantive donation to the Food Bank of Delaware. Other things that we've done is supplied all of the backpacks for Stop the Violence Player Chain annual back to school event, and routinely share funding opportunities with the Wilmington Police Department. As some of you may all know, that a lot of the CVI funding that is available federally now has to be applied for by law enforcement. And then also they recently asked us to write a letter of support for a CDS application, and we gladly participated. Next slide, please. We have brought Cure Violence back. I won't spend too much time going over that, as I've focused already on what Cure Violence does. Actually, Councilwoman Oliver actually presented them a proclamation last week in town, and that is their CEO, their global CEO, Dr. Monique Williams. And so one of the things that we really valued with this was based on a comprehensive landscape analysis facilitated by Cities United. We then met with an independent party to really assess what would be the best intervention suited for Delaware, and they determined that it was CVG. And so recognizing, again, that they have reported outcomes, a 75% in reduction. There was also, again, relationships with some of the groups already here on the ground, and they are not only just doing the 3 weeks intensive training, we have ongoing technical assistance, and that is a resource that, as we've shared with the mayor's office, they are welcome to share individuals who they would like to go through the training. Next slide, please. And so I think that this is really important, and part of the reason why we really were sold on Cure Violence Global is that they recognize that it's a comprehensive approach, and recognizing that we need to be clear on our target population, but also it is the school systems, it is healthcare, it is access to nutritional foods, mental health services, et cetera. And so recognizing that they not only treat gun violence as an infectious disease, they recognize that the work must be done in partnership. Next slide, please.
Madam Chair, Councilmember Johnson is here and he has a question.
Okay. All right, Ms. Footman, just one moment.
Yep.
I would like to recognize Councilman Johnson. And Councilman, did you have a question?
Yes, I do. Thank you very much, Ms. Footman. And just I wanted to know if historically you've talked to city officials about the original Cure Violence, because I don't know if you're aware, I was, part of, working with the city when we had the original program. Actually, Daryl Chambers was a part of it, as well as one of your board members, Mike McLively, actually as well. So, have you looked at the historically what happened the first time we tried this, and then applied those lessons going forward? Because I'm just surprised the two of us have not connected yet, as I was heavily involved in the first program.
Yes, I am very well aware of what happened when Cure Violence came here the first time. Mike actually is on our board and is our lead TA individual for our policies that we do forward in terms of advising on our landscape analysis and also understanding Cure Violence. Cure Violence is the oldest program, and then also it has research and evaluation. I am absolutely happy to connect with you. I'm not sure if you're aware, but when we had the Violence Reduction Council meeting, we did invite members of the Public Safety Committee, and I have spoken probably ad nauseum to some of your colleagues. They can probably tell you that privately. But yes, I have been engaged with members of the committee, but happy to set up a meeting with you and answer any additional questions.
Okay, yeah, that's perfect. I just and I have a lot of insight as well. I want to see if he's successful. I just want to learn what learn lessons from 10 years ago, so we can apply them going forward.
Yes, and Daryl knows that anytime we bring someone to Wilmington, I always have a conversation and say, Daryl, this is what we're going to do. What conversations do you want to have with me and that person before we move forward? And so Kobe, who is actually in the picture, he and Daryl stayed in contact from 10 years ago. And so they're available, and again, they are open to talk to any members of council, and we're happy to also facilitate that as well. And also can schedule some time with Mike. I was just texting him today that we were.
Yeah, perfect. Yeah. It was great to work with. All right, perfect. Thank you.
Absolutely. And so here are the trainings that we are providing. And so these are the organizations that are going through the training. And again, there is a standing invitation. I will share it with public safety because historically we've been having these conversations with the mayor's office and have taken their recommendations on organizations. But if there are others that you think would benefit, we are here to assist, but we have one last training coming up on June 1st through 5th, and they actually are all held here in Wilmington. Next slide, please. And so here is our grantee community of practice. Here are the organizations that we are currently working with. We do have representation through all 3 counties in our actual community of practice, and our goal really is to ensure that organizations have the tools to be successful, not just with doing intervention, prevention work where appropriate, but then also making sure that they have nonprofit compliance and also are able to have longevity and really meet the expectations of public-private investors. Next slide, please. We have a healthcare community of practice. Unfortunately, Kent and Sussex are experiencing upticks in relation to their previous numbers, and so Danielle also leads our healthcare community of practice, where we convene all of the health systems across the state to really think about how they can best support communities who are dealing with gun violence, and really think about that case management that they need. We've had presentations by the Domestic Violence Coordinating Council, as well as Christiana evolved as the only recognized HVIP in the state, so others can learn from them. And so we see it as a growing opportunity to really continue to break down silos. We actually have the Javi coming to present to this group moving forward to really understand how hospitals nationally are ensuring that even with HIPAA and other regulations that we are able to really fully integrate healthcare communities within our larger communities of practice and also our ecosystem. Next slide, please. We have CVI investor meetings. These are initiatives that we've had even prior to me coming, and it really is an opportunity for public-private investors to think strategically about how we invest and sustain this work. It's really important that, again, we do have a multi-pronged approach. When this work was first started, the plan was healthcare, corporate, philanthropy, and then also government, but we understand that it's even more imperative, more than ever, that we continue these conversations, and we're very intentional about how we are not only collaborating, but sustaining this work moving forward, and also ensuring that we are streamlining applications where possible, research and evaluation, just to really ensure that people are not having to do double the work for the same types of grants. And so this is an event that we actually had at the Hyatt here in Wilmington, and it shows where we are bringing state leaders, corporations, and also philanthropy together to really sustain this work. Next slide, please. And these are emerging initiatives. I'll start with the Workforce and Community Safety Alignment Council. That actually was a build upon from the public-private breakfast we had at the Hyatt. It is something that Chicago has done very well, and because of the size of Delaware, we see it as an opportunity really to ensure that individuals who are justice impacted and justice involved have access to opportunity and career, and we're reducing those barriers. So we launched that actually in Second Chance Month, and so we are happy to have presence of the Delaware Small Business Association, the Bankers Association, WISPAS, State Chamber, Newcastle Chamber, really thinking about how we can break down barriers and ensure that we are not only funding the work, that people actually have access to quality employment pathways. And then we also have the Delaware Government Alliance that we also launched in April. April was very busy, just to ensure that there is investment in this work at the state, county, and local levels. We recognize that the funding landscape is very different, I think, than when a lot of these programs just happened. And so in the last 6 years, you had ARPA, you had CARES funds, there was more public investment just generally in a lot of these initiatives, and there's a domino effect of what is happening at the federal level. So just making sure that individuals are not just saying, oh, office equates fiscal. No, office equates that there's capacity to do this work, and also making sure that where there is opportunity for investment, people are, we're being judicious with our resources, and also making sure that there are some shared understanding. Our goal is not only to have people, the public and private investors invest, but also to be informed investors. And that concludes my program, and happy to answer any questions that you all may have. And thank you again, Chair McCoy, for the opportunity.
Thank you so much for presenting. Did we have any other council members that had questions about the presentation? Okay. So one of the questions I actually had, because I don't know whether or not if anyone who's actually watching this at this present moment is very familiar with a lot of the acronyms that have been thrown around. Mm-hmm. And so I just want to make certain people have a better understanding of the types of things that we're talking about. And one of the things that I was actually really curious about was End Community Violence Now and its inception. I think it's just, when did it start here in Delaware? Is it everywhere, in every state? And I just wanted to know, when did it start here in Delaware?
Yep, absolutely. So ECVN is not a national organization. It was actually created here locally. We formally, Danielle filed the paperwork in 2023, and we were recognized in 2024. It was really a thought process within Governor Carney, Thayer DuPont, Chris Crothers, from Jesse Ball DuPont, Chris Grunner from Welfare, and then Christianity Care, Bettina Riveros were the funders who funded the work. And then the organizations that advised on the community side was Wolfie from Center for Structural Equity, David Chin from Christianity Evolve, and then John Cook from GBI.
Okay, thank you. So the other question, well, the other comment I just wanted to make certain that you're aware of is initially the Chief Campos stated, "Oh, am I supposed to be at this meeting?" And I'm like, "No, you don't have to be at this meeting." But I made him aware of what the meeting was supposed to be about, that you were presenting. He's like, "Oh, that's a great group. They have these great meetings." So I do realize that he is very connected and making certain that you are involved and that data is being shared regularly. So that does make us, feel more at ease. So I didn't know whether or not anyone else had any questions, or if not, then we can actually ask people from the public if they had any comments. So I do have the sign-in sheet. I didn't know whether or not these people that are on the sign-in sheet, whether or not they wanted to give a public comment. I can actually go down the sheet initially. So I already have you, Ms. Footman. Ms. Tanetta Brown, did you did you want to speak publicly?
Well, just simply thank you
Oh,
for.
if you wouldn't mind.
Sorry.
Thank you. Yeah.
I'm Tanetta Brown, and I currently serve as a board member and board secretary for In Community Violence Now. And I just wanted to thank you all for the listening ear and the opportunity to fully share where the organization has evolved and the efforts we're trying to do, and just everything we can possibly to get everyone on the same page and all hands on deck to really address, community violence in totality. So thank you for the opportunity.
Thank you, Ms. Brown.
Chair McCoy, one thing, I'll get in trouble if I don't say this,
Okay.
is that philanthropy did say that they are at the table, that they are willing, some of them even to come back from Florida to meet with you all to talk about co-investment and braiding of funds. And so just know that there is an open invitation from Longwood, Jesse Ball, and Welfare to have any meetings to talk about how they do their part in sustaining this work as well.
Thank you. We appreciate that information. All right. Ms. Fisher, did you wish to speak? Did you have a public comment?
Nothing to add.
Okay, thank you. So, this person on, okay. All right, so I do have someone who's on virtual. I have a Ms. Tracy Murphy. Are you still with us? Ms. Murphy, if you would mind, please raising your hand. If you wish to, oh, you don't see her? Do you still see her on there?
No.
Okay.
I think maybe there's that's a star.
Okay, see her. Okay.
Yeah, and then,
Okay. So wait a minute. She wrote her name down here, though. She's on there as well.
no, I think she might be.
Okay. Yeah, I'm about to say.
My name is in attendance.
Okay. Yeah.
I thought that was a star.
Okay. I was about to say no. She's in here. She just signed her name. Okay. Okay. All right. Councilwoman Bracy, did you have any questions?
Yes, thank you, Madam Chair. Just one for Lauren. How can, thank you for that presentation first. And second, how can Wilmington City Council be supportive of the work? I know you said you've been in conversations with the administration, the mayor's office, but specifically as the body of City Council, how can we be supportive of what you guys are doing and trying to continue here in Wilmington?
Yes, thank you, Councilmember Bracy. I think the recognizing quorum, if you all, and I can work with you, Chair McCoy, I believe that probably setting up a meeting with Welfare, Jesse Ball, and Longwood would be helpful just as you are going into budgeting. One of the things there, context for Jesse Ball, they're only funding gun violence prevention for the next 3 to 5 years in Wilmington, and that's a huge shift for them, that they are no longer funding anything else but gun violence in Wilmington. And so I think that there's a huge opportunity just to braid funding. So happy to schedule those meetings.
Thank you. Did you have did you have a follow-up, Councilwoman
No,
Bracy?
I think that was what I needed to hear. Thank you.
All right, thank you. Councilwoman Harley.
Yes, thank you, Madam Chair. Lauren, thank you for the presentation.
I'm not very familiar with this particular program, so I have maybe like two questions. So one,
Absolutely.
what? Well, the presentation was at a very high level, which I totally get it, and I think you laid it out very nicely. But I'm not clear on how does that look like in the community. Like, what how do you work in the community with the organizations? That's one question. And then the second question was, what is the cost of working with your organization?
There is no cost to work with our organization unless you wanted to provide us a contract to do a particular service. The state of Delaware at one point did contract with us to facilitate certain work for them, but no cost just to work with us. And what does our work look like in the community? It is whatever the community organization needs. So that means that if organizations, for example, Stop the Violence Prayer Chain needs book bags, we give them book bags. It could be that you need support to go to a conference. We either fund it or find other people to do so. In terms of connecting to individuals that are directly impacted, that is something that we do quite often. We spend a lot of time actually working with individuals who actually were grouping gang involved and have decided to turn their lives around to help transition them to credible messengers. We have two of them actually here with us. And so some of these are names of individuals who you may have seen in the paper at one time or another, not for positive things, but recognizing that we do believe that an important part of this work is making sure that they can be positive members of the communities in which they're a part of. Other parts of it is just getting a call and saying, hey, how can you help partner with this? And so our Wilmington CBI calls, we've been doing them for almost a year now. So that helps us stay pretty in tune to what is happening, but also all of the groups who have who I've been made aware of, they were invited to actually participate in our landscape analysis with Cities United, and also were able to help inform our first ever strategic plan as well. We also, individuals that are coming with lived experience, we do make sure to compensate them as well for their time, because we do think that that is important as well. So I have built a lot of relationships with organizations in the community, but always think that there is ways to meet new people and then also deepen those where appropriate.
Awesome. Follow up, Madam Chair.
Yes, you may.
Okay, so that's great, Lauren. So two questions. So are
Yep.
you currently working like with Network Connect and or Wolfie's group, like currently right now?
Yes, I am working with Daryl. I spent 3 hours talking to him at Hotel DuPont on Friday.
Awesome. And then lastly, do your organization work with any of the schools?
So in Wilmington, so we do not do direct programming in the schools of Wilmington, but we do give grants to support intervention and prevention capacity if that is what some of the organizations want to do with the grant. So we don't do direct service, but they do direct service. So if organizations are looking to do work in schools, they absolutely can come to us for funding. But one of the things I will say is we have actually just met with the board chair for some of the Christina School District, and met with Dr. Joyner as well to talk about ways that we can better collaborate, because some of the successes that we've seen down south in Laurel has been strategic connections, and we've met with a handful of other superintendents as well, but happy to connect you with Danielle, who is leading that work, if there are specific schools or superintendents you would like us to meet with.
Awesome. Well, thank you very much. It looks like you have a great model and a great offer here. And it's my first time hearing about it. So I'm really happy to learn about your organization. And if I have any follow-up questions, I'll get your information. And again, thank you very much. And thanks for the work that your organization is doing. Thank you, Madam Chair.
Thank you.
Welcome. So actually, I did have another question. Wanted to find out, because you said CVI a few times. Wanted to find out specifically, are you talking about a specific group, or just, a community violence interventionist in general, and who are the groups that you're working with?
In general. So for the groups that we are working with, and I'll just focus on Wilmington because I think that that would be what you're focused on. We are working with Center for Structural Equity. We are also working Project New Start. You saw them. They are thinking about some strategic ways to pivot just based on their current efforts. Other groups that we've Born for Brothers with Tremaine. We've engaged JACC with Ms. Congo Wright. We've also engaged Pastor Guy in different times. And so, again, there is a standing invitation. And I guess one of the questions, and we can talk about this offline, is just the best ways to, if there are other organizations that you think that we should collaborate with or want, there's always an open invitation. And so we've gotten some recommendations from the mayor's office as well. We've reached out to some of those groups too.
All right, thank you. All right, so if there are no other questions, and did Ms. Murphy ever raise her hand? No. Okay. All right. As well, Ms. Footman, thank you so much for coming to present. I do see that you have a very large following. I didn't know whether or not anyone actually had anything to state before we had finished up your presentation.
No, thank you so much.
Okay,
Chair.
all right. I said, well, enjoy the rest of your evening, and I'm certain that we'll be hearing from you again.
Yes, thank you.
All right, our next presentation, our next discussion is going to be Public Safety Strategic Plan Priorities. So we have our staff here with us.
Yes.
All right, and if you can please introduce yourselves.
Yes, good afternoon. Chair McCoy, members of City Council. My name is Elijah Simmons, Chief of Staff for City Council, and I'm joined by
Dr. Kendra Brumfield-Nawangna, the Legislative Research and Policy Director for City Council.
Okay, thank you. Oh, no, I just wanted to make people aware that this is something that our staff has been working on. This is basically coming from different council members on the actual Public Safety Committee and throughout council, just getting some ideas about how the things that we should be prioritizing when it comes to public safety.
Yes, you got it. All right, so starting off, this presentation slide, as Councilmember McCoy said, Public Safety Committee Strategic Priorities. Next slide, please, WITN. So what are we trying to accomplish today? So today we're trying to walk through the different priorities that were raised during council member individual one-on-one discussions, where we met internally with council members one-on-one and asked them, like, hey, you're on the Public Safety Committee. What are your priorities? What are things that you want to focus on for the rest of this council session? Then what we're going to do is we're going to show how Council Chair McCoy's priorities align with the different themes raised by the other committee members a part of this committee. Then after that, we're going to open the floor for feedback, raise any questions, debate, and any points of agreement. And then we're going to begin narrowing towards different projects, pieces of legislation, or any initiatives that the committee can overall work on that will be put towards that finalized strategic plan. Next slide, please.
I just have a disclaimer. I did not get a chance to meet with them, but we were already made aware that we needed to prioritize what we wanted to see within all of the chair members, all the chair boards were supposed to make certain that they prioritize what they wanted to see in their committee. So I put that information together. Unfortunately, I didn't get a chance to really have that one-on-one with you guys, but I just kind of so this is probably going to be anything that's coming from me is going to be fairly new to the committee. But it does align. It looks like it aligns a lot with what other people are thinking.
Yes, definitely. Okay, so how do we get here? So back in January, on January 22nd, we had a committee of the whole meeting where it was agreed upon that the priorities for the strategic plan will be refined through the different standing committees. Then, as I said, we did the individual council member one-on-ones where the priorities were gathered by each committee member. And then what's going to happen next is the themes, we're going to align them in order to identify them across the different committee members. And then today, as we're going to have the committee discussion where members are going to discuss, debate, and begin consolidating them down. Next slide, please. So as far as the discussion goes, basically, as far as gathering a consensus, you all are going to figure out, okay, what do you all agree on? And then you're going to propose what projects, initiatives, or legislation can move forward. And then you'll also think to yourselves and see, okay, which priority may need more definition or action. And then finally, if there's any data or reporting that council should request from the administration, that's another thing to start thinking about as well. Next slide, please. And then as far as next steps after today, you're going to document where you all are aligned, where you may have disagreed, and what may need more work. Then you're going to consolidate the discussion into a clearer committee priority statement that will be put towards the strategic plan, which we'll do here as staff. And then we'll name any potential projects, legislation, as said before, and then we'll compile them all into the finalized and approved priorities that'll go towards the strategic plan. So I'll pass it off to Dr. Kendra, who'll go to the next slide that will cover Council Chair McCoy's priorities in comparison with the consolidated priorities of the committee members.
Thank you. And thank you, council members, for giving us the time to make this presentation. You can go to the next slide. So our Councilwoman McCoy, she, as chair of the Public Safety Committee, she provided 3 priorities. And again, just to repeat her disclaimer for the council members present, is that she did give these, and we thought it would be a good way to structure the conversation around these priorities that she's presenting, that she wanted to be able to adapt and adjust with her colleagues. So I'll read her priorities and then read the other objectives submitted by the committee members, and then open it for discussion for your thoughts. You should also have the handout that includes all of the priorities from all of the committee members as well, if you'd like to follow along there. So for priority 1, the proposal is mental health and family stability. This includes the goal of stabilizing households before crisis. This would build on CPSI, the Community Public Safety Initiative, Partners in Care, schools, and MSK, My Sister's Keeper. This would strengthen expanded hours for safe havens. Is that correct, Councilwoman McCoy?
Yes.
Embedded responders and family referrals. Some of the new things would be mental health ambassadors, pop-up wellness days, summer transition plan, and some of the success could be measured by few crisis calls and stronger families.
Now, I just want to let you know that you generalized this for the city. That was just basically coming from me.
Right.
But you just read, but as the slide that they're reading actually says, not MSK, but community centers and things
Right,
of that nature.
yes. So for the community, for our other committee members, some of the responses that we received in the one-on-ones that we felt like matched well with this priority or could align with it were having community response systems, including Partners in Care, developing alternatives to emergencies, alternatives to traditional policing or without police involvement, and also expanding access to mental health and substance use services. So with those goals in mind, I would like to open it up for the council members present, if you would like to talk about whether you've, just to make sure that everyone who responded, that you feel like if you feel like your priorities would be better placed somewhere else, or if you feel like this is fitting to the discussion.
As far as mental health and family stability goes.
Right, yes, priority 1.
Now, so I do have a question. So the only responses that we have are just from the public safety?
Yes.
Okay.
Yeah.
Now, would other members like Councilman Harley or Councilman Owens able to give their input as well?
Yes.
Okay.
I think Councilman Owens had a question.
Oh, yeah, Councilman Owens.
Thank you, Madam Chair. So my question is, when it comes to expanding mental health and substance use services, if the city is not the direct provider of these services, how are we looking to expand it? Or is this more of a funding opportunity for ongoing programs that are out there and we kind of just identify them working with the administration?
Well, I would say keep in mind these are priorities. So this would be for us as the staff and research team to look into, as a local authority, what you could do to address those goals in your capacity, whether that's forming relationships with other levels of government or things that other local governments are doing that could maybe be advanced here. So it would depend on you all as a committee and as a council body, but just saying that if that's something that you feel like is an appropriate priority.
And if I may, Chair, one thing that I will add, when we're going through the different priorities, just understand as well that a lot of everyone a part of the Public Safety Committee tended to be on the same page. So it is okay if we don't have too much discussion. Just kind of wanted to just point that out there for the committee members as well as members of the public.
Yeah, and of course, I think you all know where to find us, so there are always opportunities if after this you think of anything else.
Yeah, track it down.
And just kind of a note for the public who are here, one of the things with the open meetings requirements is that it's very difficult to communicate with council members like this because of not having a public meeting that's posted. So this is why it's kind of, this is the forum to be able to do this. So priority number 2, the proposal is community connection and youth engagement. And so some of the things that Councilwoman McCoy suggested were having a goal of replacing isolation with structure and opportunity. And you all are welcome to expand on these things that we've discussed as well as we go through this discussion. To build on CPSI, youth programs, and community spaces, to be able to strengthen by expanding WEST, and I take it that's CPSI.
Yes, so that's actually making certain that we cover more of the city.
A consistent presence and tying to safety zones. Some things that would be new with that would be having block captains, youth night zones, micro grants, and adopt a block initiatives. And some of the success could be measured by more engagement and a visible presence. So some of the objectives submitted by committee members that seem to align well with this was community policing, meaning additional community engagement and targeted neighborhood presence, and also investing in youth, which would include education and youth support programs as long-term violence prevention strategies. So with that, if anyone would like to elaborate, or if there are any questions or thoughts on those, on priority number 2, which again is community connection and youth engagement.
Okay, well, I would like to just state that when it comes to the goal of replacing isolation with structure and opportunity, that is kind of lofty, but I definitely feel like it's something I would like to try when it comes, especially when it comes to the people within the community, within my community. One of the things that you stated that was new is block captains and adopt a block. Those are actually things that I've already started in my and within the 6th district. The block captains was a block captain / ring program. I purchased ring cameras for those who participated to become block captains, and they will promise to do so for 1 year and attend meetings and things of that nature. So this is just making certain that we're a little bit more engaged and connected with one another. Other than that's, like I said, it's more so about community engagement.
Thank you. Seeing no others, we'll move to priority number 3. And again, if anyone has any, I think, yeah.
Councilwoman Harley, you had a question?
Yes, Madam Chair. So these priorities that you're sharing tonight, they pretty much are targeted areas coming out of your district, first and foremost, but to be applied or implemented across all 8. Is that the plan?
Yes, so as I was stating, like my disclaimer, I had put this proposal together thinking about how I would like to prioritize things, and I submitted this information. We're making it more so citywide because there are definitely more things from the committee members that kind of coincide with what I stated. So that's what's on, that's in the black portion of, mine is very specific to my area more so because of the things that I've actually done. But what it looks like on a citywide, I guess a citywide trend would be what the other members have actually put in.
Okay. All right. Thank you.
All right, Councilman Owens.
Thank you, Madam Chair. Again, I really think these are good starts for us when it comes to youth engagement. I like the micro grants opportunity of it. I know anyone on the council is probably going to laugh because I like spending money. But I do know, like the city of Philadelphia, their Office of Community Safety or Public Safety, I forget the name. Once they established, they created a grant program for like community violence prevention programming. And it's not a lie. It's from $5,000 to $50,000. So maybe that's something that we can work with the administration on once they get their footing. That maybe we can establish some type of micro grant program to identify certain key areas throughout the entire city. I know you've been a huge advocate about getting some more resources, especially at MSK, with their late night hours over there, and also expanding CPS over there as well too. So I think this is a really good start, and hopefully we could come together on it.
Okay, thank you.
And just to add some context to the micro grants, that was also something that was suggested with when CPSI was formed by the consultant, the collective that did the consultation. And one of the things that they brought forward was that micro grants, maybe those organizations that aren't ready for large infusions of funds, it can help them build capacity to be have more of a presence in the community. So just putting that out there as well. So again, I know this is just the start of the conversation, so please feel free, even after this presentation, if you have any other thoughts. Again, Councilwoman McCoy's proposals were just like a nice structure because they align so well with some of the other things that you all brought out in the one-on-ones. So priority number 3, the proposal is safer neighborhoods and accountability. And the goal would be shared responsibility for safety.
WI10, next slide, please.
Yeah, oh, sorry. This would build on the WPD, the Wilmington Police Force, RTCC, 311, and clean teams. This would strengthen transparency, data alignment, and foot patrols. Some of the new things would be having a dashboard, the rapid response teams, the winter clean team, and mediation units. And success could be measured with faster response times and increased trust. So from some of the other committee members, some of the things we heard were mentioning the Office of Community Safety, and that as being a central hub for violence prevention and community-based responses. Also thinking of the Office of Community Safety as an office for development and expansion of some of the activities for safer neighborhoods, and having more council involvement in the Office of Community Safety. The other thing that was also mentioned that we felt like would align well here is police accountability, increasing police transparency, and also strengthening the Police Accountability Board. There are some other suggestions. Yes, next slide, please. Some other things that were mentioned were enforcement in addressing illegal activity in corner stores and similar establishments, and also addressing the oversaturation of certain store types in specific neighborhoods. And this would include quality of life concerns, meaning graffiti, loitering, nuisance businesses, and general disorder in communities. And so with that, I will open it up. Any thoughts or anything that anyone feels should be added or subtracted from these priorities?
Yes, I will begin by stating you could cross off the winter clean team. Because I believe I've been too new. Also, just wanted to let you know that RTCC is the real time call center.
Oh,
Just
right.
wanted to make certain that those who are listening knows what that is. So, we want to make certain that everything when it comes to the real time call center, that all of the cameras are working, that, that that we are capable of getting that information out or seeing whatever is happening at the time that it's happening. I've already heard previously on our, I'm sorry, I'm blanking, on our budget hearings about ShotSpot and all those different pieces of technology that we are using to be able to identify the things that are happening here within our city. So we're gonna make certain we have all that information, and then how do we use it to see, make certain that we are deterring or discouraging just types of activity that are happening, like the graffiti, loitering, and general disorder.
I think Councilman Harley has a question. Madam Chair, I think Councilwoman Harley might have.
Oh, Councilwoman Harley, I'm sorry.
Yes, thank you, Madam Chair. I know I'm not on this committee and I'm not going to be able to stay on long, but I just want to say that I think these are some great first steps and great ideals, especially as it relates to not just in the sixth district, but across the city of Wilmington, because as we know, and I'm just saying this for the sake of the public, that this would definitely um, expand throughout all 8 districts in the city of Wilmington. So I just want to say that I think that these are some great objectives, and I'm looking forward to learning more about them. So thank you.
Thank you. Anyone else have any other questions? And was this the end of our presentation?
One more slide.
Okay.
Next slide, please. And so some of the additional priorities are things that were brought out in the 101s that we didn't feel quite fit with the priorities that were presented. And so we'll be looking to you all to give us maybe a title or a theme for these. The public safety pipeline, and that would be strengthening the pipeline into police and fire careers. And the other thing that was mentioned was having new public safety initiatives, such as EMS improvements, efficient and effective implementation of new initiatives. And so those were some of the other things that we didn't want to just try to, make them fit into the priorities, but make sure that they were mentioned as well for your consideration. So with that, if anyone has any theme for those, and also if, I know you're just kind of getting to see these, but your feelings on whether these 3 priorities really align with what you all had in mind or would have in mind for a strategic plan for public safety going forward.
And if I can just kind of emphasize what Dr. Kendra's saying, so when we have that final strategic plan document in our hands, it's looking at public safety committee and saying priority number 1, mental health and family stability, priority number 2, community connection and youth engagement, and then priority number 3, safer neighborhoods and accountability, and then listing out one by one what all of those different examples are that the committee has created. That would be that encompassed strategic plan. That's what it would look like. So just want to get an understanding if that's okay with everyone here. Councilmember Darby, I think, has a question.
Councilman Darby, you have a question?
Yes, no, I'm okay with the makeup. I wanted to just, hello. I just wanted to speak to the. I'm trying to find it. Is it still on the screen here, or did it go away? But I wanted to speak to the things that we had on there. I don't think we can talk about public safety at all without talking about workforce development, right? And that's one of the things I wanted to say because we were talking about creating a pipeline. We want to talk about increasing community policing, but if we don't have the actual physical human being to do it, and we struggle with numbers and getting people on the police force and then getting people to want to be in the community engagement department. I think those things are important. And even pipeline for me means how do we get more black and brown individuals into our fire department, into our police department. Your police and fire department should be reflective of the population and makeup of your community. And currently, that is not the case for the city of Wilmington. So I don't think we can even talk about all the other things if we're not talking about workforce. So I think it has to be a part of it, just based on what I think. So I know it has to be a consensus. And then I think the other one was EMS services. So we know that we had paramedics when the St. Francis had the contract, and we know that they couldn't do the contract anymore. So our fire department did it, and they are certified in EMS services and are doing it, and probably are doing a phenomenal job. But there are limitations. There's a difference between an EMT and a paramedic. Paramedics have more authority to do certain things when they're responding to people. So currently, right now, if I don't know what procedures, I'm not even going to make something up, but whatever medical things or more things that a paramedic can do right now when they're responding to people's homes, some EMTs can't do everything that a paramedic does. So the level of service that we're giving our community has changed, and the amount of authority that EMTs versus paramedics have. So I think that's an important conversation to have. And we also know our fire department, the majority of the people are complaining about the new model because they're signed up to be firemen and women. And some of them are like, why am I doing my shift as an EMT slash almost acting as a paramedic, but don't have all the authority? So I think those things have to be addressed because we already have an issue with retention in the fire department, and then switching up their role to now do EMS services is crazy when we can do exactly what Newcastle County does and create a paramedic program, or even tap into Newcastle County and partner with them and do a paramedic program. So I believe these have to be a part of the conversation because we're not talking about how we are treating people, the services we're giving to our city, and workforce development, then everything else means nothing. So thank you.
Thank you. Councilman Owens.
Yes, just thank you, Madam Chair. Just going back to that last slide when we were talking about EMS services. So again, I think one of the initiatives should be making sure that we are able to provide EMS services out of all six of our fire stations. Right now, currently, it's only out of 5 of them. With no services out of Station 4. Station 4 is first due to the vast majority of the first district. So if Station 3 is busy, or Station 5, which is all the way over Charlie Square, if those 2 stations are busy, we are now waiting for Brandywine Hills or Brandywine 100 or Tallyville to respond to my district. On calls like that, again, every second matters. So outside of a level 3 call, the fire trucks will not go out to anything under a level 3. They're not being dispatched to that. So the services aren't equal to the first district right now. And I know it's something that I've been talking about for a long time. But then also looking at the back end of EMS services on how we can make it more user friendly for our department, so that we can make sure that we're bringing in the revenue that is required to keep our fire department in the black during while we're taking on this task. I remember we had this before and we lost money, so then that's why we contracted it out. But the city of Wilmington is it's a huge undertaking. Almost each shift, they're taking about 20 to 24 calls per 24-hour shift. So they're constantly out there. So we want to make sure that we just better integrate that and make sure that we're aware of like where we're at as a city as well too.
Okay, thank you. Actually, when it comes to what's going on with the firefighters, well, first I would just want to say thank you so much for whoever actually brought this up. The public safety pipeline. I do think that this is very important. I'm glad that you didn't squeeze it in anywhere because it is very important that we make certain that we try to get the people from the city those types of jobs. I'm like, can be crucial to be able to have a career like this and still live here in the city. And we want to make certain, as Councilwoman Darby stated, it that our force kind of reflects the demographics of our city. So that would be good. I like this. The when it comes to the new public safety initiatives, EMS improvements and efficient and effective implementation of new initiatives. I'm not exactly certain about that second portion, and I'm wondering whether or not that has more to do with the when we had the undertaking of the EMS services to the fire department, and whether or not I've actually heard complaints about the fact that the I'm sorry, what is the word? It was sugar. I can't even get it out. So I'm thinking. No. So what it is that when it came to how they were like how they were actually bringing this information about and making sure that everyone all had the same information. Hold up. I'm so sorry. Business. Okay. Standard operating procedures. I kept on thinking SOP. I kept on thinking SOP, and I'm like, what is SOP? The standard operating procedures. Thank God for a smartphone. So the standing operating procedures in that I've actually got complaints because they felt as though they didn't have them or they didn't have them in a timely enough fashion. There was some back and forth. When it comes to EMS, this is, first of all, our firefighters are contracted, and this was a contract that was voted on by a majority, I guess, of the fire department. And then this is actually a heavy lift. This is something that they're going to have to probably go back to the drawing board about in another year. I'm like, but what administration has done is they made certain that they just hire, I think got like 16 firefighters are going to be coming through. And then in July, they're going to be hiring 12 more just to be able to bring some relief because it can be tiring. Now, when it comes to how many calls they're getting, I done heard, like your number you gave is the highest number I done heard. I done heard numbers from 15 to 20 to hold up. Yeah, it was pretty much the 15 to 20 range or whatever. That might be per truck, per unit. And also the fact that I have brought it to the attention the fact that the station that's closest to this first and second district does not actually have a bus. So and that if we actually included one and had one, that may be lesser calls for the other units. So these are the types of conversation that we've already had when it comes to talking to administration and also when it came to the budget hearing and how we look at our budget for the city. This information has been brought, and and right now I think the only thing that I managed to make them realized needed to happen was actually getting more people. That's about it. But we're still working on that, and we want to make certain that we don't lose our firefighters. We do realize that, first of all, we already deal with attrition. It seems like every year we're losing a few of them to retirement and such, but we don't want to lose them because of their dissatisfaction with their with how things are working. So we're definitely trying to make sure we bring that to the administration and make them aware of things that are being stated. They're working on it in their way, and we're trying to make certain that we push it in ours. That was all. I just want to make certain I addressed it.
Okay. One comment, Council Chair. Appreciate the conversation and discussion. I think after having, receiving this feedback from you all, I might have figured out where to place these last two priorities. So looking at the public safety pipeline one, if we go to priority 2 that says community connection and youth engagement, it's talking about the investment in youth. So when you talk about a pipeline, you do a pipeline through the youth and you build them, raise them up so that they, you train up a child in the way they should go and all of that. So with that being said, I think we can place that pipeline piece into the priority 2 of community connection and engagement and tie it specifically to that youth investment. And then as far as the EMS improvements and being efficient and effective when it comes to implementing new initiatives, I think we could place that into the safer neighborhoods and accountability perspective, because if you look at it, where it talks about the Office of Community Safety, it mentions council involvement and it mentions police accountability. So that has to do with coordinating and speaking with the administration, sitting down with them and coming to an agreement with what council wants to see, what council's priorities are. So I think we can tie it into it through that perspective to that third priority there. Thoughts? Does that work?
I'm just glad that we are finding space for those, because those are two very important things that we needed to make certain do not get overlooked. Councilman Owens.
Thank you, Madam Chair. Just in regards to the youth engagement and getting them in the pipeline, again, we currently have the Explorer program through the fire department. It's a wonderful program, and I'm saying that because I also went through it. I was the deputy fire chief. But I think also expanding that over to the police side as well too. I know we have our youth academy, which is about to start out, where they get to learn about both the departments, but on an ongoing basis, a year-round basis, actually doing an in-depth like understanding, but then also training under them and under the national umbrella as well too could be beneficial.
Okay. All right, so thank you. Did you have any more for us to discuss? Or did we have to make some type of decisions now?
No, I think we're all good here. This was a great discussion, great conversation. I know you leave it open to the public for comments, but I do want to say one final thing. As far as that document that was sent to you all via email of the different council member priorities that are part of this committee, please feel free in your free time, take a look at it, review it, read it, and kind of see what your colleagues have said, see things that might have been similar to what you were thinking, maybe different, and have open discussions, conversations amongst each other, just to kind of, come up with ideas for what could be done for city council and for the city moving forward for the rest of this session.
And we'll take this feedback and create a new document, updated based on what we've received here. And so, again, if you have any other thoughts after this meeting, feel free to contact us and we will add that to the document. So thank you all for listening. I think this was a very good discussion and a good way. And this is something that's going to be rolled out to all the committees. So as chair, feel free to look at that format, or we could use your format as a structure for discussion with the committees that you're a part of as well.
Okay. All right, thank you. Well, I do hope that, if anything, maybe just having this discussion, oh my gosh, I'm so sorry, I'm so tired. This discussion will help maybe jostle some things and maybe make us think of some other things that we may have overlooked.
Yep.
So I do look forward to the next iteration of this strategic plan. All right. I said, well, if there isn't anything else, that I have any public comments or anything about our strategic plan, yes, please. If you could come and introduce yourself.
Good evening. It has been a long day, so forgive those things. I'm Sierra Hall-Hipkins. I'm Executive Director and Co-Founder for Network Connect. It was great to sit in on a strategic plan. A lot of what you presented are the focuses and priorities of our strategic plan. So that's one thing I wanted to just reiterate, that the focuses that you have there are happening in community, and I would ask this committee to seek community advice, counsel, and help, because we're not the only agencies. You mentioned MSK and a lot of other collective impact partners of ours who are working in this work. I also want to note that myself and some of my team are here for this portion of the audience, as we are not Network Connect. While we are a part of the Community Public Safety Initiative and one of the leaders on the Wilmington Street team, we are not a part of the ECBM work. I also wanted to make sure that you had our most recent, see, I'm doing it too, our most recent data report, our annual report from the street team work, as well as our financial findings for this committee to review it as needed. Thank you, and I appreciate your time.
Thank you. Was there any other comments from the public? All right. Seeing none. All right. So I just thank you all for joining us this evening. This was actually a very great conversation, and the presentation was excellent. I'm glad to hear a little bit more about ECVM. Okay. All right. That's it. So if there's nothing else, then I'm going to ask for a motion to adjourn the meeting.
Motion to adjourn.
Can I have a second?
Might just be me and you, Councilwoman.
All right, I will second that motion.
A second.
All right, thank you, Councilman Darby. I said, with that stated, I said, the meeting is adjourned. Thank you all so much for joining us this night.